So our next presenter is Allison Kerwin. So Allison received her bachelor's degree from Cornell University, and she has it in the background so you can see how lovely it is. And she's currently a PhD candidate in Dr. Tom Overton's lab working on transition cow nutrition and health. Her presentation is entitled Association Between Haptoglobin Concentrations and Disease Incidence, Milk Production, and Reproductive Performance at the cow and herd level.
Thank you, Dr. Borman, for that introduction. As she already stated today, I'm going to speak to you about the association between haptoglobin and cow and herd level outcomes. So just a brief introduction as to what haptoglobin is. Haptoglobin is an inflammation marker which is found in the blood, and it's virtually non-existent in a healthy dairy animal. However, at the onset of an inflammation event, haptoglobin increases over 100-fold, which makes us an interesting marker for research purposes. Furthermore, measuring haptoglobin in fresh cows may help us to identify cows that are at a greater risk of developing disease or provide additional tools for herd level monitoring, which may help dairy producers improve their health management programs. Previous research has demonstrated that cows with elevated postpartum haptoglobin have an increased risk of disease, specifically metritis, decreased milk production, and poor reproductive performance. However, these previous research trials established haptoglobin thresholds on limited data sets, often from controlled research trials and not from large epidemiological studies, which leads me into the objectives of my study. So we wanted to establish cow-level thresholds for haptoglobin concentrations for predicting health disorders, evaluate the association between elevated haptoglobin on milk production and reproductive performance. We also wanted to identify the haptoglobin herd alarm level that's associated with herd level changes in disease incidence, milk production, and reproductive performance measures. And the haptoglobin herd alarm level is going to be the proportion of animals with elevated haptoglobin within a farm. So jumping into the materials and methods for my large epidemiological study, we evaluated haptoglobin on in cows across 72 farms that were located in New York and Vermont. And we took blood samples from cows from 11 to 24 animals within each farm that were 0 to 17 days in milk. But we were only able to measure haptoglobin concentrations on those cows that were 0 to 12 days in milk. So we have a total of 988 animals in this data set. Moving on to the results for the first objective of my study, which is to identify haptoglobin thresholds at the cow level that are associated with disease, we observed that animals with a haptoglobin concentration of at least 1.52 grams per liter were 6.6 times more likely to be diagnosed with metritis. Animals with a haptoglobin concentration of at least 0.68 grams per liter were almost 5 times more likely to be cold within 30 days of milk. And animals with a haptoglobin concentration of at least 0.55 grams per liter were 2.5 times more likely to be diagnosed with metritis, clinical ketosis, displaced abomasum, or any combination of those disorders. For the second objective of my study, we investigated the relationship between the thresholds just identified and milk and reproductive performance. The thresholds reported for this analysis are the lowest thresholds which have the largest estimate and the strongest association with milk and reproductive performance at the cow level. So animals that had a haptoglobin concentration of at least 0.55 grams per liter produced 386 kilograms less 305-day mature equivalent milk at the 4th test day, or approximately 120 days of milk. And those animals also had a 25% decreased risk of conceiving by 150 days of milk. Animals with a haptoglobin concentration of at least 0.68 grams per liter were 0.8 times as likely to conceive at first service. Now, I would like to note that we did find an association with that 0.55 gram per liter threshold with conceiving at first service. However, it was not as strong of an effect as the 0.68 threshold. And just to look at that conception by 150 days in milk a little closer, this is a survival analysis curve. So we have the percentage of cows that are not pregnant on our y-axis and the days of milk on our x-axis. And as you can see, all of the cows are not pregnant within the voluntary waiting period, but as time increases, more and more cows become pregnant. So we have the animals that have elevated haptoglobin concentrations in the blue line, and those animals had a median day to conception of 114 days compared to 101 days for the animals that had low haptoglobin concentrations. For the herd alarm level analysis, we evaluated the proportion of animals with elevated haptoglobin concentrations on disease, milk, and reproductive measures. We used the thresholds previously identified in this analysis and 30% was the initial proportion evaluated, and that proportion was lowered in 5% increments until the highest estimate and lowest p-value were determined. So herds that had at least 20% of their animals with a haptoglobin concentration of at least 0.55 grams per liter had a 5.8% increase in disease incidence. Herds with at least 10% of their animals with a haptoglobin concentration of at least 1.52 grams per liter had a 2.5% decrease in 21-day pregnancy rate. And herds with at least 20% of their animals with a haptoglobin concentration of at least 1.52 grams per liter had a 6.4% decrease in conception risk at first service. Now, I would like to note that we did not identify a herd alarm level that was associated with milk production or 21-day conception risk. And this just shows you the prevalence of elevated haptoglobin using those herd alarm levels that I identified on the previous slide. So on the y-axis, we had the percentage of herds, and on the x-axis, we had the proportion of cows within each herd that have elevated haptoglobin, concentrations. So just to kind of direct your attention to this table, again, depending on which outcome we're interested in, we have about 13 to 50%, 56% of our herds that we sampled that are actually below that herd alarm level. And this would indicate that we have room for improvement in the dairy industry, and we should really investigate the cause of this inflammation that's resulting in increased levels of haptoglobin. So I do have some takeaways from my research. First of all, our results do support previous research at the cow level. We did evaluate cows with elevated haptoglobin. Those animals did have an increase in disease, decreased milk production, and poor reproductive performance. But this research also allows us to evaluate haptoglobin at the herd level. And previous work has established herd alarm levels for metabolites associated with energy balance, like NEFAs and BHBs. But measuring haptoglobin at the herd level provides us a unique opportunity to address non-nutritional challenges such as management and environmental aspects that might be associated with inflammation. But I would like to talk about, the practical use of this, whether it's using or measuring haptoglobin at the individual cow level or whether we use it more as a herd level monitoring tool. And as of right now, I think we're better off using this as a herd level monitoring tool just because we currently do not have a cow side test like the BHB meters that we have. So, by the time we actually take that sample from a cow, send it off to a commercial lab for analysis and get that result back, that animal might already have have some kind of other disease. So it may not be super practical looking at the individual cow level as of right now. And I would like to note, we evaluated many different assays for measuring haptoglobin, so we really do have to be careful as to what assay we use, because there's not too much, a lot of the assays don't necessarily agree with each other. So, and there's currently no gold standard either. There are a couple commercial labs that do analyze haptoglobin for you, one being University of Guelph, which is where we send our samples to, and the other being Kansas State. However, I know Kansas State, the assay that they currently use is not valid with plasma samples. And we've had that experience. So whenever you are taking samples for haptoglobin analysis, I do suggest using serum instead of plasma tubes. And, I talked about how hopefully, by measuring haptoglobin at the herd alarm level, we can hopefully identify some of the sources for inflammation. However, we really don't know what are some of these non-nutritional factors that are associated with inflammation. And that's kind of some of the future work. That's where we're going with my data set that I have. So we are going to be evaluating the association between elevated haptoglobin with non-nutritional factors such as stocking density, commingling of heifers and cows, Penn State particle separator, but we're also going to be looking at the non-nutritional factors as well and looking at that relationship between the far off close-up and the fresh period nutritional strategies. So with that, I do have some acknowledgements. First off, this study was partially funded by the New York Farm Viability Institute, Pool and Grain. We also received a multi-state hatch grant and Elanco US. And I also want to send a huge thank you to all the participating farms, nutritionists, and veterinarians, and all the people who assisted me with data collection. And of course, the study collaborators, Dr. Tom Overton, who's my advisor, Dr. Daryl Neidham, and Dr. Buzz Barkhams. And with that, I'll say thank you and I'll take any questions.
We do have a couple of questions for you. So I'm going to ask mine so I can read the other ones and then ask them Then. So you had a range of days for when you were taking haptoglobin. Is there an association between haptoglobin levels and day of collection? When does it typically peak, or is it pretty steady during that whole time?
Yeah, great question. So I actually have a great graph in a different presentation that actually shows where haptoglobin typically increases, but it kind of seems like haptoglobin is typically the highest between 3 and 7 days of milk. And then it starts tapering off after 7 days of milk, but you definitely still do have some cows that are outliers beyond 7 days of milk.
Okay, great. And then we do have some other questions. When looking at the association between haptoglobin and metritis, did you consider only haptoglobin measurements done earlier than the metritis event was diagnosed? If could high haptoglobin be a consequence of metritis? So did you, okay.
Yep, great. No, great question. So in all the health disorder analyses, if the event happened before we took the blood sample, that cow was removed from the data set. So it's only evaluated the cow's, future events, not events that already happened.
Okay, great. And then one more question. Were there any parity interactions with haptoglobin and the repro outcomes? So were there any differences between primiparous and multiparous cows with reproductive performance and haptoglobin?
Great question. And I think I actually need to look back at my data analysis, but we actually grouped all these animals together in the analysis just because, especially with only being able to capture the animals that were 0 to 12 days of milk, we didn't have enough power really to evaluate just the primiparous animals alone. So I felt more comfortable grouping all the animals together for this analysis.